Family doctors are bleeding. It is a very hard environment to be working in.
Family doctor Rita McCracken knows just how important a long-term plan is when it comes to long-term health. That's why she's not fully sold on BC's interim plan offering financial support for family doctors.
I'm very pleased that there is action happening. I have some concerns about what we can expect a lump of money just to the physicians to do.
On Wednesday, the Health Ministry pledged $118 million for family doctors province-wide over the next 4 months. That means about $25,000 or more for 70% of doctors in BC to pay growing overhead costs.
There will be a process for doctors to apply, and if they do apply and they go through the process in September, the money will arrive in October.
But questions still linger over what that will mean for clinics.
There's not a lot of clarity about what the expectations are for that money. For example, are physicians going to stay open for the same number of hours that they have previously? Are they going to keep all the patients that they have right now?
And as for 1 in 5 British Columbians still short of a family doctor,
how will this action help those million people who don't have a family doctor? And the short answer is, I don't think it's going to.
Well, the short term, it will certainly help defray the costs of, hiring staff and paying for supplies.
This Victoria doctor among many who are cautiously optimistic, but points to glaring issues of compensation, as many family doctors leave to make more money in other roles, including inside hospitals.
In order to address the shortage that we have to be able to not only retain, but also recruit doctors back into community family medicine.
BC's health minister pledged a new compensation system that will be detailed in the fall, but it will likely take far longer to roll out. Until then, advocates calling for a midterm plan once this latest round of funding dries up.
This is a short-term fix. It's only going to be for the next 3 months, and we need to have a much, much larger discussion about how primary care is going to look in the future.
A major shift that seems to have taken its first step, with many more to go. John Hernandez, CBC News, Vancouver.